please ask me the question again. Kumbukeni.
So,
What were what was the
and I'm
question?
glad you said what you said because it clarifies my point. When you say that the WHO has described universal healthcare as what you just pointed out to us, right? Everyone has access to healthcare. And by the way, the United States does not have universal healthcare. Just an FYI. So, and the United States is who is currently apparently advising Kenya on how to move forward on healthcare. So, just an FYI out there. So, what you just described is corruption and fraud 101 because if these salaries are being allocated manually and it's saying that most of the money is going to salaries, someone is pocketing the money. So, and it is intentionally being done because if it wasn't intentionally being done, if the World Bank is giving money so that Kenya can improve and they are actually interested in that and they want to see their money used well, they would hold Kenya accountable as far as putting infrastructure, systems that make sure that everything is accountable. But they're not doing that. And we have to ask ourselves, kama hawa watu, and we know how strict they are on things. If they're giving money, why are they not putting systems that ensure that their money is spent well, right? There has to be something else going on. So, data activists, we spend all these hours in these spaces talking about SHIF, talking about Gashagwa, talking about Gen Zs being abducted, talking about agricultural policies that are coming, when all of it is based on neocolonialism and imperialism. Why are we not opening rooms to talk about neocolonialism and imperialism and how to stop it and defeat it?
Kumbukeni, you know, um, let me tell you why. You and I are familiar with neocolonialism and imperialism and all of that. But yule jamaa, yule mama, yule kijana kule mashinani aelewi hii maneno. And what we found, and this is why I say so, what we found when we went to Bungoma on the ground, and it's the same thing I found even in Embu, this information does not trickle down to the mashinani. Imagine in Bungoma, they don't know about these bills. They didn't even know about the agricultural bills. They were being told, by the way, do you know there's a bill that says if it passes that you'll have to have a license to plant the things you have been planting, your father was planting before you, your grandfather was planting before your father, and so on. Now you'll need a license, yeah, and all manner of things. They don't know. So we need to educate them pole pole. When we start telling them, if we start telling them about neocolonialism and imperialism, you'll confuse them. Because how does that affect them? When we tell them about them, the licensing of the seeds that they will need, them being licensed to plant the seeds they have been planting all their lives, that affects them directly because they have to feed their families. Yeah. But how do we bring that conversation of neocolonialism and imperialism to that show down there? How does it relate to her? You see, I don't know how I would even start that conversation. You see,
But what you're saying is actually
kumbukeni.
what I'm going for. In these rooms, we should be talking about how are we going to make this conversation digestible to the mashinani. That's what we should actually be talking about, strategy in these spaces. How are we going? What KOT and data activists are doing is part of it. There's a farmer. I don't know if he's here, Maina. He comes to the spaces. He's another one who's also explaining imperialism in a language that they can understand. He's not saying imperialism. He's not saying the U.S., but he's explaining it in a language that they can understand. So instead of sitting here and talking about SHIF, why don't we talk about how are we going to message this in the localities where people don't understand the bigger picture while still addressing that bigger picture? I think that is time better spent and that is going to actually get us something. But data activists in the layer, I appreciate you. Asante.
Karibu. Well, let me push back on that. You're saying that I think we should also, you see, it's a multi-pronged approach. We can use that and also discuss SHIF as well. Why am I saying that? Because it's not even 1 month since SHIF came into play, and people are dying because of SHIF. Why do I say so? There is a video that went viral of this surgical resident who was saying how she had to send away patients who had paid for an appointment, probably even because she's a surgical resident, probably for surgical procedures. They had months on for that appointment to come fall through, and then when they come, SHIF has taken over. They are sent away. Mind you, they had paid fully paid NHIF. The surgical or whatever the treatment that they needed was approved by NHIF, and yet they are being sent away. And then you found this old man who had to do dialysis, yeah, and he was being sent away because he required 9,500 shillings on top, which was the case HIF. Yeah. So the way this thing is being implemented is completely unprofessional. The idea was if they wanted this thing to work, they should have made it transition so that those guys who have been approved by NHIF for their surgical, for their surgeries, for their treatments, and what have you, are embraced by SHIF. They don't have to pay anything extra. They did so many things wrong, honestly, that to me, I think these guys just want money. And which I don't know, real Joe, let me give I know naongea sana lakini allow me to give some perspective on household expenditure, because this affects each and every one of you. Yeah, each and every one of you. There is data I analyzed, and I think we were with Real Joe when I was giving it during a space on Sunday, yesterday. I've called it the Financial Resilience Funding an Emergency Event in Kenya. It is based on the Global Findex 2021, which is compiled by the World Bank using nationally representative surveys of more than 128,000 adults in more than 120 economies, representing 91% of the world's population. Yeah? But what I decided to do was focus on Kenya. So this is the scenario for you. Basically, I focused on a question that asks whether how difficult one would find it to fund an emergency within 30 days. So these are the results. 50% of the population would find it very difficult to fund an emergency within the next 30 days of the emergency. 34%, which is a third, slightly more than a third, would find it somewhat difficult. And only 16% said they would not difficult at all to fund that emergency. So what does that mean exactly? When these guys at SHIF decide to send away that old man because of 9,500 shillings, that guy will probably not be able to fund that emergency event because he probably falls within these guys who find it very difficult to fund it. But then another thing comes into play. When these emergency funds, where do they come from? They come from certain sources. One, family or friends, money from working, selling assets, savings, borrowing from a bank, and other sources. Now, a majority, 30%, comes from family and friends. 20%, 19% comes from working. So you're most probably going to go to a chama or mchango or your friends, family, but that is where 30% of that money is going to come from. So again, if a number of us are going to be sent away by SHIF, we are going to keep going for these mchangos. Are you going to decide who you're going to changa for and who you're not going to changa for? You know, these guys don't take these things into consideration. And then now, let me bring the perspective of age group, because when it comes to difficulty of funding an emergency event, the guys who are 25 to 34 years of age, yeah, only 43% of them said they find it very difficult, because 57% said they find it not very difficult. And this 25 to 34% are the ones to the diaspora to work there. These are the guys who would be helping guys here, but yet they are being sent away to work outside the country. So again, where are our priorities? Where are our priorities? You know, so then I bring. Let me talk about the last one, which is education, because I found education to be very interesting, and it's something that Kumbukeni has also mentioned when you mentioned about um, politics, and why I think these guys are deliberately sabotaging our education. It shows here that those who find it very difficult to fund an emergency event within 30 days, those who have a primary school education, 60% of them find it very difficult. Those who have a secondary school education, 47.5%, while those who have a tertiary education and higher, only 16% of them find it very difficult to fund an emergency event within 30 days. So when we sabotage our education, yeah, we are putting this economy in a crisis. And I think that is deliberate, because the system was working without the university funding model. Why are they bringing that university funding model? Why is it that they want to include income of your family? And why are they complicating the system? Which the Americans say, if it ain't broke, don't fix it. It's working. So kumbukeni, I'm totally by the way. I can go on and on, because I can take you even down to the agriculture and why I think they are doing the things that they are doing based on data. But I won't go into that. It will be lengthy. Um, John, back to you. Back to you.
John, before you go on, data activists, I definitely want to work with you. I'll be reaching out to you because we need to put this information that you're talking about in a space where people can, in a database where people can access it. So I'll be reaching out to you.
So. I think John, maybe John's nini has hung. So maybe I can go on kidogo if John is not. Wanjiro, are you there? Wajiro?
Yeah, yes, I'm here. I'm just. Can you hear?
Niendelee ama
Unaweza endelea, but General China pia alikuwa hapa. Sijamsikia akiongea.
Yeah, I've seen he has raised his hand. Yes, General China. You can go ahead.
Yeah, then
General.
Okay, fine.
So good guys. So me, I'll actually just bank on the reason why, according to me, like the reason why I believe that there's no sense of moving Mwananchi from NHIF to SHIF, and I have the following reasons. So like you see, like in the initial NHIF, they have come like with a model just to fool the public, because truth be told, like the in terms of like our economy, our GDP, we cannot actually implement what is called universal health coverage as per now. That is something we must agree on. Like right now, we cannot implement it because we've first of all, we are not well established. We don't have those funds. We fully depend on funds that have borrowed to do all this stuff. So NHIF, let me just go to NHIF and SHIF. NHIF, this is the initial one that we were using, And this is a medical insurance that Kenyans have been using for all this far. And we have been experiencing, like, every time there's problems with NHIF. That one is so evident, unless you are always getting a special cover from the different from what others are getting. People have not been getting quality medical care. What now they have embodied in the SHIF. So, like, now they have come with the SHIF to they first of all they preach SHIF and they talk about UHC, Universal Health Care. Those are two different things. Very, very different things. Those are two different things. So they have gone to the UHC, they have carried all the qualities that are there in the UHC, and they want to lie to Mwananchi that now if we move from the initial one that we've been using, the old model, the NHIF, if we move to SHIF, it's like we are attaining the universal health cover, which is false. The reason why I'm saying this is, like, the initial NHIF, there was range, like, if you had a salary of like 20 Gs, they used to take 750 shillings to 1,700 shillings from the normal Mwananchi. And that amount that was being taken from Mwananchi, from those people who earn from 20K and above, we could not see significant, like, health improvement in these hospitals. My friend, maybe I'm speaking to guys who have just seen the presence of private hospitals. You need to go to the public hospital for you to get these realities on the ground, and how this thing, like, it's just a total scam to fool Mwananchi, and it's just a mess. It's just a total mess, because first of all, they have not explained to us. You need to come to Mwananchi and tell Mwananchi, like, we are moving from this one to this one. What are the benefits? You can't tell me in Africa, there's no health cover that can benefit you if you are paying low. They are telling us that you pay, this one has been reduced to 300 to 500 shillings. In any health cover, provided you pay low amount, be rest assured that the medical quality will be of low quality. So let us not be lied to. They are saying that SHIF now can cover from 300 to 500. Then if you go to the other side, there are people also who have been armed, like the guys who are being paid salary of 50,000 and above. How can just somebody implement something, then they make a deduction equivalent to 20%? Those people are almost paying 10K. Almost 10K for people who are running 50,000 Kenyan shillings and above. They are paying 10K for this stuff. And this is not a stuff that we've been having, and we can count that there's a benefit we have always gotten. You know, if it could have been beneficial to us, we will not be using this private insurance that have come in place. And this is something we are paying for. Very many Kenyans are paying for this stuff. If some are not even aware of it, you just find your salary has been deducted and you don't even know how this cover works. So this is just at me. I can say I'm not supposed to say this will cover me. Don't let no one know that I'm in the field. It will be very bad if I'm posing this and there is something they are pushing us to propose and to tell all good things about. But me, I can't lie to the public because I know what people are going through right now. There's another issue again with the NHIF to moving to the SHIF. You are being told that by 30th you would have moved from NHIF and registered for the SHA for you to avoid the penalties. The question is, this insurance cover that you initially had in the you initially had on the NHIF, where is the cash going to? Because right now, if you come to the hospital, come to any facility, even the private facility, the first thing you'll be told that NHIF stopped working on 30th. Mark, you paid. Remember, you paid full cover. There are people who have been loyal to paying this money and they've paid all the money. Then you are being told NHIF is non-functional. So for you to start using HSIF and that one I will talk in the case of inpatient. If you are being admitted as an inpatient, this SHIF you have to pay the 2K per day. That one, whether you are in public hospital, whether you are in private hospital, it's a policy they have put that you must pay 2,000 shillings each and every day. Like, my question is, like, where's the normal Mwananchi, normal Kenyan, who cannot even afford a normal meal in a day, going to get this money? For me to just prove to you that all these things are mess and they don't care about the normal, the person at the lower level that they claim they are fighting for. This thing is not even for them. This thing, me, according to my opinion, this thing is just going to support these people, like, who have good salaries, like 100K and above, who will be paying the cover, and at least if they are admitted in the as the inpatient, this thing will be covering for them. But for the normal person, you can't pay 300 and expect, like, you have a chronic disease like, let's say, cancer. You have a chronic disease like cancer, diseases like diabetes, that this thing will cover for you. That's fallacy. It will just remain. You will just go to the hospital there and they will tell you the amount you have paid, the cover you are paying can only cater for you in the outpatient. But what are they telling people outside there? They're telling people outside there that this is the best cover that has embroiled the Linda Mama, because they have brought even the maternal part of it. It is inside here, the Linda. They removed the Linda Mama from the other side. They are now saying it is part of the SHIF. So you will tell me that, let's say in a duration of 2 months, you have paid 600 shillings. Then you have gone to the hospital. You have gone to the hospital with a chronic illness. In a real sense, will 900 shillings, let's say you have paid for.
Generally, I can't hear you. If you can't, are you breaking? Unfortunately. Data twist, can you hear Generali?
I can't hear him, but I want to tell him something. He has really raised something that is pertinent. And there's something called, and you guys should come tomorrow and you'll listen. There's something called the NHS, the National Health Services. Now, the National Health Services is the system that is used in the UK. Yeah? So tomorrow, when we are talking about county healthcare,
Because this is a total scam. This is a total scam. This is just a pure scam. In fact, I will just say people would have been surviving by the normal.
Generally, you're breaking.
Yeah, let me tell him. General China, you're breaking. So maybe talk alafu tena, then I give you the mic.
Okay.
Sababu we didn't hear a very large part of what you said. That requires.
Okay. Let me drop first.
Okay. We hope you don't break. Okay. Go ahead.
Okay. I was saying, the NHS, that's the National Health Services, is a system used in the UK. And tomorrow we'll have somebody who has worked in the UK as a medical practitioner and is very familiar with NHS. And we want to ask questions related to how we can make it work here, because it works there. Of course, no system is perfect, but we can learn a lot from what is working. You see, because if it is working there, you see, the shift that we have implemented here, we are not even modeled it against any country. Yeah, they have just given us SHIF. They haven't told us it is working in Egypt or we are modeling it after this guy. They haven't told us anything like that. They are just implementing. And by the way, NHIF was working really well for a number of years. You see, so someone will come and talk about NHS, the National Health Services, and how it works. Because, by the way, when it comes to insurance, health insurance, NHS takes care of your health insurance kabisa nicely. But you guys will hear from that professional, and you'll be able to ask questions as in what happens in the UK. Think of the various scenarios that we're having here. Then you ask those questions based on that scenario there. Because if it is working there, I'm sure there is so much we can learn from something that is already working before we even implement ours. You see, there's a lot we can learn. So there'll be that. And I wish General, you're back. So General, you've raised a number of key issues, and I like that. Please join us. I'll inbox you.
Quickly, Data.
Please join us tomorrow.
Data, before General goes back, because he was submitting great stuff, but with that statement you just made, And I'm glad you're doing that because NHS works really well. They have maternity for women a whole year and they're fully paid when they take off work for a whole year. So that you're right, the UK system is functioning well and it will be good that you'll be presenting it. But here's my question again, as General comes back in to speak.
Wait. Before you ask the question, please tell us more about NHS.
I don't.
You're familiar
only know
with
it through family. I live in the US, so I live in the middle of dysfunction. I only envy NHS, so I'll be one of the students paying attention to exactly how it operates.
Okay.
But one of the things I know, because I was complaining to family who live in the UK, that over here in the US, maternity, you get it if you get it for 6 months and you're not paid 100%. In the UK, you get it for a whole year and you're paid 100%. So, which is a great advantage for us women, and for the community in general, because that is us raising families, which is essential in building the population. So my question is, so yes, we find out, and which we will find out for sure, that the NHS works. This is how it's done. This is how it's implemented. But I just explained, and you understand it, that our managers, our governance managers, the president, the parliament, everyone who's put in place to manage is operating fraudulently and intentionally sabotaging our system while pocketing money in their own personal coffers so that they can grow their wealth. So we as Wananchi, we find out, how do we move forward? How do we implement what we learn tomorrow? How do we, without the support of our governance structure?
Beautiful. I like that question, and that is a question I had posed to one of there's a member of the High Court. I posed during one of the spaces. I posed a similar question. I asked about whether we can, because I found when we're dealing with these numbers, the issue of ghost workers, and that the powers that be, the county executive, do not follow the recommendations of the controller of budget. So your answer is basically what you told me, which is this: we can actually what we need to do is to do an audit of what these guys, the governance people, people who are in office, and then we can remove them. You see, the idea, Kumbukeni, is to educate the masses, because maybe even the powers that be are not familiar with how these things work. And then when we educate them, we do public participation, because I've realized most counties do not do public participation on these things. And that's where the experts are really helping. Yeah, because an informed public will be able to push back on things and say, this is not working the way it should be. Yeah, so the information is key for the public and for the county executive as well. We can be able to kick them out, by the way. There's a way we can do. I was told, by the way, that even when it comes to this, the payroll, the county payroll, you can actually ask for a citizen's audit. There's a way of doing a citizen's audit through legal channels that clearly shows you how much has been paid to whom, when, whether they are casuals, they are full-time, and all that. Yeah, I'm yet to see one being done, but that is something that I would like to see get done. Because the minute we start doing such kinds of audits, trust you me, they will take things even more seriously, because they know the power of the people to do the audits and to keep them in check. You see, but right now, because of lack of information and education and all that, and they don't do public participation, we are a bit of a disadvantage. I hope I've answered your question.
Yes, Asante.
Yeah. I see Nothing Ke has joined us. Nothing, Karibu, please take the mic and join us hapa tusikie maneno mawili matatu kutoka kwako. Joe, back to you. I see your back.
Okay. Hata mimi wacha nikaribisha Nothing. Hi sister Nothing. Welcome back. Guys, please also request the mic. Si ati sisi ni wataalamu hapa. We are not actually hakuna mtu mwenye ni mtaalamu. We have the CS of health. Hata yeye akiambiwa discuss about universal healthcare and SHA and SHA. Hata yeye hajui, so ni sisi tujisome, ni sisi tujieleze, ni sisi tujuzane. So that's why the intention of being here, and we actually call ourselves Wakenya wazalendo. Ndio maana tuko wazalendo, sababu tunapenda nchi yetu. Nobody has an answer on this. Hata president saizi akiambiwa give a reason, I'm pretty sure oh my God, I'm pretty sure Ruto can't even explain what SHA and SHA is. But everything is not going according to what we'd like it to go. That's why we are having these spaces every other day. Sababu kama Wakenya wazalendo na kama wapenda nchi, lazima tujuzane. Haya, I don't know what's next. Diljo, karibu.
Thank you, Wanjiru. Sorry, I had a little bit of technicalities, but yeah. So we actually somehow along the way deviated from SHIF and went into the healthcare. I don't know how to put it. We went into health as a whole, the health sector as a whole. So we deviated from SHIF, which is something that is more like really is something that I don't think is bad, considering that SHIF is not actually the solution to our universal health coverage. Maybe just to answer the question that we have for the day and also give my submission on the same. For me, I think SHIF is not the solution to universal health coverage. Universal health coverage starts from, and the data you had asked me about devolvement of health. And I think I answered that question tactfully. I said it should be devolved. And I did not tell you it is devolved. So I have a reason why I said it should be devolved. Of course. And you clearly pointed out that why is SHIF not then devolved? And you gave your reasons for that, which is, I agree with 1,000% if that exists. So for me, SHIF is not the solution to healthcare coverage. Universal health coverage. Universal health coverage begins from how we do allocation in the health sector, the health ministry. It is one of those ministries that is underrated while one of the very, very most important. If you look at the budget allocations towards health, we tend to lack priorities in terms of budgeting in our country. We have a budget for health and we don't even have a proper budget, clear budget for even research in matters health. Okay? We don't even have budget allocations towards research. I'm so much concerned about this and don't think things like Cambry and all those other things are sufficient in terms of research. I mean, Cambry is actually, the agenda is actually mostly pushed by the United States and things like that. But we see some of the things that also Kumbukeni had talked about, when these issues in terms of globalizations, they all depend on one thing. And I've said this before in other spaces that, civil vigilance in a country then ensures that we don't have those kind of things like we talk about sometimes in terms of GMOs and all those kind of things. We do our own research, and budget towards research is part of civil vigilance. You would hear that some people talk about things like, maybe multinationals in terms of companies are pushing their own agenda. So in case if they are a pharmaceutical company and they want to push their drugs, they'll then push for things like GMOs so that as many people as possible can get sick, then they push their products. That is something that is there. But then how then do we protect ourselves from this? If we don't have proper budget allocations towards even research, we are blinded. And I agree so much with to some extent with Juza when he said we are operating from a point of data blindness because we do not have proper data on some of these things. Now, on SHIF itself, SHIF,
real joke. Real joke quickly.
Yes.
But that's the issue That's the issue I'm pointing out. The reason we don't have budget is intentional. The IMF has instructed Kenya they cannot do it. The IMF has instructed Kenya they cannot fund their health system. If they do it, they're sanctioned. This is intentional. Like, we keep asking, why is this? And I'm telling you, it is intentionally done by these people to keep Kenya underdeveloped. For those of you who haven't read How Europe Underdeveloped Africa, it is intentional.
I will not commit to that. I will not commit to that fully. I wish we have another space to discuss that again. But just to also talk about you see people like data activists do a lot of research in terms of data, and they provide some of this data. And I don't see why then this data is not put into action. I don't see that. I'm trying to put those two, like the actioning data and multinationals in one sentence. I have a problem with that. I'm one person who never likes to think in that direction of maybe multinationals and people trying to limit us in this kind of things. I never like to think in that direction. Kumbukeni, unfortunately, I never. Why? I'll tell you why. Basically, for me, and how I've just been able to travel here and there, I would have reservations with that. Let me not say so much into that. I would have reservations with that. But the big question here, the SHIF itself, when it comes to universal health coverage now now the health insurance fund in our country, you see, the problem that I personally have with SHIF is we've had NHIF. NHIF has been functional for several years. And as someone who understands systems, and as someone who, that is what I do as my career. That's what I do to earn a living. I do systems. As someone who does that, and as someone who has even done systems in the healthcare industry, including level 6 hospitals, I will not mention a lot of this, but as someone who understands this, I then also understand that to roll out a new system, data pointed into some features that are supposed to be available in 2026, but were rushed. But that's not even my problem. For you to roll out a new system, there's something that is called, the transition has to be seamless. But it's not about just having a seamless transition. There's something that we miss out in terms of how progressive the transition is. Okay? How progressive the transition is. Data pointed out there's someone who is covered in NHIF in a certain service that is not going to be available in SHIF. This person has been contributing money to NHIF for the longest time possible. Okay? And as someone who also would then gets health insurance covers, like even things, the medical covers that we do. Give you an example. You go and get a medical cover from Jubilee, and you have a medical cover that gives you a definite amount annually, say $500,000 on maybe inpatient and things like that. NHIF, you have a coverage that you are contributing money to. Then you transition now to SHIF. Okay? How is it then possible when you are transitioning? You're supposed to think ahead and see how are we going to make the transition progressive in a manner that this transition, when at the point of transition, we are still able to get health services available to Kenya. How are we going to achieve that? We still need to have health services available. Okay? What then is wrong with the old NHIF system? Is it this? See, personally, when I talk about system, it is three things for me. It is actually the software, the procedures of use, and the users. Policies is part of the policies and procedures. So when I talk about the NHIF system, the old system, what are we migrating to SHIF? Is it the software, the policies, and things like that? Some of the policies are implemented by SHA. That's why people keep talking about the two, SHA. So SHA is the authority. SHIF is the insurance fund. So then we are now have the issues with policies. So this is a long conversation that can take us a lot of time discussing. And today we are just introducing it. I'm sure Wanjiru will be able to host another space. We'll be able to host another space. We'll never discuss this. We wish to discuss this in detail and more. And I have one of our co-hosts today was not even spoken. John, I don't know why, John, you haven't spoken. I think for me, if I continue to talk about SHIF, SHA, I would speak until tomorrow. But let me allow data activists, because we are looking at ending the space at 8 p.m. We have another space starting at 8 p.m. With Mizani and Dr. Okot, just to talk about the constitution and things like that. But I want to give the speakers in the panel time to maybe give their final remarks. I see Data as his hand up. I would give you time, Data. Then I'll give Nothing. Then I'll give General like that. Juza, then Kumbukeni, as we look at closing the space. So I'll give you guys time. Keep in mind that we are closing the space at 8 p.m. So when you give your submissions, just finalize. Thank you.
Thank you, Joe. I wanted to ask you something, since you're a systems person, a systems analyst actually, and I know when I was talking, I mentioned piloting, and most people may not necessarily understand what I meant by piloting. So my question to you would be, since you have done a number of these health systems at large scale, what would you give us a ballpark figure of how long it would take, let's say, to pilot, that is to test this system before fully moving away from NHIF and for SHIF to take over, based on your experience and the size of the project?
Thank you, Data. I'm happy with your question, and I would happily answer that in a minute. See, first of all, Data, I'll tell you something. You see, most of the level 6 use a certain software called Pansoft. So we were coming into the market with a different solution. And when it comes to piloting, when it comes to system, piloting is part of the development process of a software. And therefore, when you are talking about piloting, that has not gone into production and should not be used in production. You know, piloting has not actually achieved what is called proof of concept. Piloting is the process of achieving proof of concept in a system. So when the healthcare system is rolled at 104 billion and rushed, and some of the features are still in piloting, that is not in production. That solution should not be in production. You know, that solution should not be in production. And you know, piloting is still like trying to test the waters with your system and things like that. So you see, when we were developing a solution for healthcare, we did this software for 3 years, and piloting took 2 years. You see, in terms of the technology and developing the actual software, once we write down the logic, the tech guys will develop the software the shortest time possible. The only reason it can take long is because when managing a team of developers, each and every person is using the language of their choice and things like that, and we are building a big solution and all those kind of things, then integrating into one software, then that would take time in terms of integrating all this. The technology the developers would work on in a short time. But the big part is writing the logic down. And the logic is supposed to come and implement a process. The logic is actually implementing a process. The software is implementing the logic. So it works back like that. So when you talk about SHIF and rolling out this project at 104 billion, and you hear that some features are still in pilot, that is so sad. And it is absurd even for someone like me to imagine that can happen in a country like Kenya. In fact, can happen in a project that is the leader of the consortium is Safaricom. That is, I'll tell you, in a normal business environment, Safaricom will not roll a project, even as them a project that gives them profit, they would not roll a project at piloting. I'll tell you that for a fact. Safaricom has done that before. I mean, you guys, you can remember Safaricom rolled out a project, tap to pay. You tap, you just tap your phone. They used to have these wristbands and things like that. You tap to pay. Where did it go? You'll never even hear about it again. If you try to do that, you're going to get it wrong. Absolutely, you're going to lose a lot of money. Just like we are losing now with the SHIF. You can hear the service is not working, it is down, and things like that. Another example is even just IFMIS. IFMIS itself. Very good examples of how government mess up Kenyans. IFMIS. And many other things. So that I think, I don't know whether I've answered your question correctly, but that's what I had to say. Thank you.
You have actually, you see, I'm familiar with how systems work, and I've implemented a number of them. Of course, not to a large scale like the way you have. So, and my biggest issue was the way it was done. The fact that they did not test it, like you've said, or pilot it, so that at some point there can be a smooth transition where you leave one and the other one automatically takes over. You know, that was not done. And how is it that it is Safaricom who are the ones doing this? Again, that doesn't add up, because Safaricom are very professional in how they do their things, you know. But yeah, from a systems perspective, I don't think they did it well. And from a financial perspective, we got robbed. By the way, we got robbed. 104 billion for a system like that. We got robbed. Daylight robbery. Because first of all, it's an open source platform, which means it should be cheaper than actually developing from scratch. Yeah? And which means the code is out there. It's in the public domain. It's open. Which means we need to ensure that we modify it to fit our scenario. There are so many things I can talk about which were wrong with the entire process. And but yeah, in a nutshell, let's let other guys say something. But thank you, Joe.
Yeah, thank you. So guys, unfortunately, we have just 7 minutes, because I told you about the space that we are going to have at 8 p.m. with Dr. Ekura Okot about the Constitution. So the speakers in the panel right now, I'm gonna give you a minute each. Unfortunately, I'm sorry, nothing. You took over this. I'm gonna give you. You go first. The other, and if it is at 7:59, we end the space because you need to join the other one. Sorry, guys. Unfortunately, so nothing. I start with you.
Hi, everyone. As usual, I salute our comrades that we lost, the injured, and those who are missing, and Kenyans at large. Thank you for the opportunity. I think a minute will not allow me to engage on the subject. I'll talk about NHIF for a moment. And NHIF was quite effective to assist some facility. First of all, for people who are covered with private medical insurance, what would happen is NHIF would pay for the bed only, and in the event that you didn't have NHIF, you had to pay out of pocket, and that was very seamless. For patients who are using NHIF, you'd need to get an approval first. The doctor has to sign the documents if you need a procedure, and a request depended on mostly the hospital you went to. There were different categories of hospitals, and people who went to government hospital, they actually got more. If you went to private hospital, you got a lot less. My question, even before we get into SHIF, SHAF, is where are the resources that were already in NHIF? Where did the money go? Because if we can remember, when Sudi had been arrested during Uhuru's time and he was arraigned in a court in Nakuru, I found out that he had been arrested because they had processed money that was supposed to be for patients accessing treatment in India, and the money was diverted to his account through some law firms. So my question is, where did the money go? The people who had money in their cards, where is the money? The property that belonged to NHIF, including the building where it's housed, who is the owner of this property? So to put in foreigners and under systems that were already working, for me, I think it was a horrible choice. We don't have time. I need to yield the mic. If it's about IFMIS has been an effective system, is what they use to disperse money to ministries and counties. And at the end of the financial year, they actually close it. So it's by a particular time that you need to have maybe paid out the suppliers or contractors. And it's easy to audit. And that's why schemes like what happened with NYS,
Nothing. I ask you.
Okay, I yield the mic.
Sorry. If you can land maybe, so that I give. We have 3 minutes.
I have landed. Thank you.
Thank you. I think nothing will do another space for this. I'll wish to engage you on the issue of IFMIS because I've worked with it personally from the onset, so that you'd know. So let me give General the mic, Juza, then Kumbukeni. I mean, try to make it a little bit short, then so that we can go and talk about the Constitution in the other space. Thank you. General is not with us. Juza, just your final remarks, then we end the space.
Oh, thank you very much. My thoughts are in one statement. Everyone, please take care of your health. It seems things are going to be thick for a while, and before it's sorted, before we go to the streets to make sure these guys never loot us dry again, please, let's take care of our health. Thank you.
Thank you, Juza. Wanjiru, I think just to be fair, I think in the tomorrow morning space, I think we scheduled for SHIF again because we've not conclusively talked about it. There's some data that I wish data activists would have told us about. I wanted to ask him, but unfortunately. Anyway, so let me give Kumbukeni the mic. I don't know whether John is with us. John, are you with us? John isn't. Sir, Kumbukeni, take over the mic.
My question is, why are Kenyans hesitant to acknowledge that imperialism and neocolonialism are the root cause of our nation's dysfunction and underdevelopment, and what steps do you believe we can take to raise awareness and unite as a people to confront and dismantle these forces that still influence our governance? And I was going to ask this and leave it as a question, but I went ahead and prompted ChatGPT. And it said that we are hesitant to acknowledge that imperialism and neocolonialism are the root cause because we have historical misinformation and education gaps, economic dependency on former colonial powers, internalization of neocolonial mentality, distrust of revolutionary movements, focus on short-term issues like poverty, corruption, unemployment, insecurity, and bringing awareness to and unity to confront imperialism, neocolonialism, host national dialogues, empower grassroots movements, create African-centered media. So sit and ask yourself where you fall in that denial, because you're all in denial. At least a lot of us are, and we need to wake up. Asanteni.
Thank you. Thank you very much, Kumbukeni. I wish to engage you on matters ChatGPT in our next space. I would wish to tell you how it works, how it is trained, and how it gets its data and all those kind of things. I wish to engage you on that because I see you refer to it a lot. But thank you very much, Kumbukeni. I don't know whether Wanjiru can give you a closing remark, then we end the space. Thank you.
Yeah, I'm here. Thank you everyone for joining. Asante Data Activist, you literally wrote this and we supported with data. That's why I always like you on the space. I'm sorry for everyone who joined, everyone who requested the mic, and yeah, we're going over to Mizani. We have Dr. Ekuru Okot, kama nimesema jina vizuri.